Hi, I am Dr. Megha Kadam, consultant neonatologist and pediatrician at Aster CMI Hospital. And today I have with me Dr. Parimala V Thirumalesh, senior consultant neonatologist and pediatrician at Aster CMI Hospital, author of a well-known book, Baby 101, and founder of the app Save Baby CPR. As we are in the middle of this COVID-19 pandemic, it has been of a particular concern for many pregnant mothers as well as our newborns. And we are in this challenging phase because this COVID-19 pandemic is adding to the burden of lot of premature babies, and lot of newborns are going into NICU for NICU care. So would you share some tips for these parents how they can cope up with such a situation?
So especially if your baby is in NICU, you have to think of NICU as an artificial womb. So if the baby was inside, nobody would be visiting your baby in and out. So, but because baby came out, don't insist on too many visitors visiting your baby, and which we all understood better with the pandemic. So restrict visitors, and also always stick to strict hand hygiene and hand wash before you enter NICU. So that's something important for you to follow.
Okay. And since parents are separated from their babies, how can parents help out in the baby care when the baby is in NICU?
I agree. When you suddenly go inside and see your baby hooked up to too many monitors, machines, and tubes, it is very scary for a young mother and father. But one thing you should know is just black it out. So do not look at all the monitors which is around your baby. Don't look at all the tubes which are attached to your baby, one for breathing, one for feeding, one for injections, etc. But just look at your tiny baby which is there, and try to talk to the baby. You can sing to the baby, you can talk to baby, you can hold your baby, you can do something called kangaroo mother care, where skin to skin contact. If your baby is stable enough, you can discuss with your doctor and we'll advise you that both you and the dad can do that. So you can hold your baby on you, which also helps. All these things will help your baby grow better and do better and stabilize the vitals as well. Because one thing you should remember is your baby can hear you and baby can feel your touch. Though they cannot see you, they can still do these two, and they're used to your voices already when they were inside. It will definitely be soothing to your baby.
And what about breast milk? How can a mom provide breast milk to the baby?
That's a good question, because extreme preterms who still do not know how to suck and feed and digest the milk and all that, you must be definitely thinking about it. My tip is that you don't waste your milk. Colostrum has highest immune cells possible, and otherwise also breast milk has so many live cells which are growth factors, helps in your baby's gut growth, brain growth, eye growth, everything. So milk is very important. You just express your milk, give it in NICU. We have ways of storing it, and we can use it for your baby as long as 6 months. So whatever you get, just keep expressing and give it to NICU. We can store it for your baby.
And since it's a very challenging time, how can a mother stay positive in such a situation?
That's a very good question. Many people are emotionally very much affected because of the pandemic, and to see your baby in ICU, such a tiny baby going through so much, and you yourself going through so much, either COVID or other infection, it is very difficult to stay positive. So something what you can do is take a break for yourself. Every day take just half an hour, 1 hour for yourself. That time do not think about baby, do not think about your family, husband, nothing. Just do what you used to enjoy doing. So you can listen to a song, listen to music, go for a walk, have a soothing shower, whatever it is which makes you feel happy, do that every day for half an hour. Then slowly you can stretch it a little longer. This small thing can go a long way. And also you should remember consciously when you enter NICU that your baby can feel your emotion. So baby can sense exactly what you feel. So if you are feeling angry, upset, depressed, your baby will immediately become very irritable, very upset, and the heart rate will go up, breathing will not be stable. And just thinking about it will change your attitude. So if you go positively inside, be happy around your baby, just touch your baby, sing song, and then feel happy around the baby. Your baby will immediately sense it. You will see that the baby's heart rate is slowing down, baby's breathing is stable, and your baby will feel much better. So just the thought of this also will help you stay positive through this.
And how can parents better communicate regarding their baby's conditions with you?
Definitely. If you see, when you come to NICU, suddenly you may not know what to ask the doctor, what to ask the staff. Maintain a very good positive attitude towards the staff, nurses, doctors, because we are in this journey together and it's a long journey. So we have few months to look forward to together in this journey. So if you stay positive and happy, that would definitely help. The questions you can ask your doctor is like, you should always remember it's one day at a time. Every day is very, very important for your baby. Crossing one day is like crossing 1 month in our time actually for a baby. So just ask how my baby is doing today, what I can look forward to in the next few days, or what is the biggest challenge what my baby is facing today. So just ask about today, get the update, and then next day you can follow it up. This simple question will tell you what are the issues and what you can do about it.
Okay, ma'am. Thank you very much for sharing such valuable tips to our concerned parents.